First of all, welcome everybody. Welcome to our Italian colleagues from the Bologna headquarters and our Spanish colleague from the Barcelona headquarters. Most of all, welcome to the colleagues from our territories of this beautiful nation. Welcome to the 2021 HNP Group staff meeting. Let me start by making clear that I would have never expected to make such a keynote speech. Less than less, a keynote speech in which we will inevitably have to look back at this extraordinary year, literally extraordinary year. Who could expect that our staff meetings, a chance to get together, to share experience, to socialize, to get to know the new colleagues, would become an online event? Probably nobody. But at least this pandemic has helped us to bring together the two teams, Italy and Spain. And despite online, this is a nice opportunity to get together as a group. Let me make a promise for the future. As soon as it will be possible, we will remake it again, together, live. Looking back to 2020, as we said, this extraordinary year has had on our lives, personal lives, professional lives, the impact of a century. It will be remembered a forever changing year under so many aspects. First, it has been a tragic year. Personal losses, pain, economic crisis, job losses, business foreclosure. We all know this, and each one of us has been touched in some way. Italy and Spain as nations have been so dramatically affected, and our thoughts are with all of you that may have suffered personal loss. But this pandemic has also affected our daily lives. Our lives have been literally thrown upside down. Family relationships, leisure time, working habits, social habit, not to mention our professional lives. Before 2020, the new normal paradigm was used or somehow misused by marketeers and sociologists to represent a fast-changing environment, creating uncertainty. Any small changes in society, new fashion or new technological gadget getting into our lives was labeled as new normal. What an understatement. Now I think this year made clear to everybody what new normal means and will arguably mean for the years to come. First, our life is and will be more and more online. Working, education, shopping, training, even eating out is more and more online. Traveling, partying, live music, theater, museum, disco, gyms, they all appear to be activities belonging to another era, and who knows when and how they will be back in our lives. Another key point. The epicenter of our life has shifted into our houses. They became our offices, our meeting rooms, our classrooms, our restaurants, our bars, our gyms, etc. But let's focus finally on our industry, the healthcare industry. Besides the tragic events and the enormous pressure that this pandemic has put on our healthcare systems, this pandemic has also brought some new normal in healthcare as well that we have to cope with, and not necessarily negative ones. First, people coming together. We are all involved in this, and we are aware that, like it or not, we will come out of it as a whole and not individually. A strong push for innovation. Think how relevant innovation in terms of use of technology, development of new treatments, value chain, research processes, mass vaccination programs, logistics are required and will be required to tackle the upcoming challenges to put all this behind us as fast as possible. Finally, all our stakeholders are aligned to a common goal. Patients, doctors, healthcare providers, families, healthcare system, policymakers, global organizations, all share a common goal, and all are contributing to such a superior goal to save lives, contain the spread of the virus, immunize the planet. From my perspective, the greatest consequence of this new normal is a sense of urgency and a sense of inclusion. We must act fast, and we must act all together. For which reason? Well, to prepare ourselves to live in a pandemic era. Yes, because this pandemic is not going to disappear, or at least not easily nor rapidly. Vaccination is far from achieved. Many developing countries may not even receive any vaccines. The ease of transmission of this virus seems to become even more aggressive or more resistant, etc. So, we will live with it for some years to come, or eventually forever, as we do with HIV or the normal flu. So this new normal will be the legacy of this pandemic year and will change our habits for a while, if not forever. And therefore, our goal as individuals, as citizens and as professionals is to cope with it and to do it rapidly. How? How can we cope with it, and what does this mean? We don't know obviously yet. What we know is that we have to devote all our competences, our resources, and focus to it in order to overcome it. It is needed and it is urgent. It is the only way to make this new normal normal. Okay, but what about us? While preparing these introductory remarks, I was questioning myself how they could be useful or even interesting for our staff meeting. Think about it. What we do at HNP hardly will change the outcome of this pandemic, to say the least. But look at it the other way around. This pandemic can change us forever. Watching how this pandemic is affecting lives, health, jobs, society as a whole, and considering business environment in which we operate, we can easily preview that this new normal will dramatically impact the way we work, the job we do, the tools we use to perform our jobs, the service we provide, and even our business model. Billions of euros, 18 only in Italy, will be funneled via the so-called recovery plan to design and implement innovative care models in order to make healthcare systems sustainable over the long term. And this has so many points of contact with our job. The sustainability goal will be pursued by leveraging some key lessons that we've learned in this pandemic. Let's have a look at them. First, people can be helped remotely, and they should be where possible. Hospital cannot bear the effort to treat all patients and all conditions. This is simply no more sustainable, so other resources have to be mobilized for the goal. Third, technology is an enabler of this new care model, and much has yet to be exploited talking about digital care. Finally, empathy has to be embedded in the systems, since sooner or later we will all be patient and fear and uncertainty will affect us. So, we don't know what the healthcare industry will look like on 5 years' time span, but we do know that some of these trends will lead a change. As we have seen, the great challenge that the healthcare industry as a whole is facing is to transform itself and to do it fast. And this is why so many resources and attention have been put on the table. If this is true, at HNP we are at the heart of this transformation, and therefore we have a duty. Our mission is to embrace such challenges, to prepare ourselves for the new normal, and to transform these challenges into opportunities. We have to be more and more innovative, efficient, and creative to provide solutions that meet these new, urgent, sudden needs. In 2019, I outlined some strategic challenges that we at HNP would have faced in order to maintain a sustainable competitive advantage over the future. Here they are again. Innovation, diversification, internationalization, and efficiency were the action title of 2019. In other words, doing new things, different ones, in new places, and in a more efficient way. Well, Maybe this pandemic has only proven us right. They couldn't sound more actual and needed today. But now, the imperative to prove us smart. We must be able to do new things. We must be able to do different ones. We must be able to work in new places and in a more efficient way if we want to navigate and possibly to lead this transformation for the coming years. So our focus for 2021 has not changed, but has become imperative and urgent. We must be fast. 2 years ago it was needed, now it is urgent. Our purpose should be complemented by a sense of urgency. A sense of urgency able to mobilize each and every one of us to accelerate the transformational innovation that we have to lead if we want to navigate the challenges ahead of us. Be fast, be innovative has to be our motto. Ask yourself what you can do better or different or more rapidly in order to continuously create value for your stakeholders, clients, patients, doctors, whoever, even your colleagues, and make it happen. I want HNP to be the place where innovation happens even at a smaller scale. It is largely up to you to make the new normal happen at HNP. Buon lavoro!